tough topic in today's health headlines. We're talking about sudden infant death syndrome, what it is, and how to reduce the risks. State epidemiologist Dr. Benjamin Chan joins us now. Thanks for being with us, doctor.
My pleasure.
For starters, just tell us what exactly is SIDS?
So SIDS stands for Sudden Infant Death Syndrome, as you mentioned, and it's one cause for sudden and unexplained infant deaths. SIDS usually involves a situation where an apparently healthy infant or baby less than a year old dies suddenly and unexpectedly and tragically, I might add, without any explainable cause or reason. And determining whether a death is due to SIDS can be complicated. It usually involves an extensive investigation, an autopsy, investigation of the death scene, review of clinical history. There are other causes for sudden unexplained infant deaths, including accidental suffocation or strangulation, but the risk factors for SIDS and other unexpected causes of infant death are actually similar and involve a safe sleep environment.
How common is it?
So in the United States, there are about 3,500 cases of sudden and unexpected infant death every year in the United States. Many of these are unexplained, but as I mentioned, some of the risk factors are the same. I think last year in the United States there were about 1,500 cases of SIDS specifically in the United States, and it's actually the leading cause of death in infants aged 1 month to 12 months of age.
Do we know what causes this? Obviously there's kind of a matrix of things that can interact between what's in the crib and some genealogical or developmental issues. What causes this, though?
That's right, and it's not entirely clear what causes SIDS, but it's thought to be a combination of factors: environmental factors, developmental factors, specifically areas, the developmental aspects of the brain that involve control of the heart rate and breathing and sleep and awake cycles. There have been studies that have looked at risk factors for putting babies at increased risk of SIDS. One of the highest or strongest risk factors is actually putting babies to sleep on their stomachs or face down. That is not recommended. Mothers smoking during pregnancy or babies being exposed to environments with tobacco smoke also increases the risk of SIDS. Having babies sleep on soft surfaces or with loose clothing or material in the crib, co-sleeping or sharing a common bed can also be an increased risk factor. And there's also been some investigation of whether overheating is involved in SIDS.
And you mentioned some of those aspects. So what's one of the #1 things a parent can do to prevent this from happening, even though it is such a lightning strike in some ways?
So we recommend that parents follow the American Academy of Pediatric guidelines. So mothers should get early and routine prenatal care. Mothers should avoid smoking or using tobacco products. They should avoid putting babies into environments where there is tobacco smoke. One of the strongest recommendations is that babies should sleep on their back on a firm, flat surface. Parents should avoid putting soft materials and loose clothing and bedding material into the crib, so no quilts, pillows, soft toys. And then I mentioned that sleeping in the same bed as an adult or an adult bed is not recommended. You know, we do encourage breastfeeding. Breastfeeding may be protective, but if parents breastfeed at night, they should put the baby back into their own crib. And if there's any questions, parents should talk to their healthcare providers.
Doctor, thank you so much for this very important information.
My pleasure. Thank you.